Turkey is often perceived as a healthy or safer protein, especially when compared to red meat, but for people with gout or chronically elevated uric acid, it deserves much more caution than its reputation suggests. Turkey meat, particularly darker cuts and processed forms, contains a relatively high purine load compared with chicken, eggs, or plant-based proteins. Because purines are metabolized into uric acid, frequent or large servings of turkey can contribute to sustained elevations in serum urate and increase the likelihood of gout flares. For individuals who are already prone to gout, the difference between turkey and lower purine proteins may be enough to tip the balance toward an attack, especially when combined with other common triggers such as dehydration, alcohol intake, or excess calories. The risk is amplified when turkey is consumed in processed forms such as deli slices, smoked turkey, turkey sausages, or ground turkey products. These foods not only retain the purine content of the meat itself, but also introduce additional metabolic stressors, including high sodium levels, preservatives like nitrates and nitrites, and often added sugars or refined starches. High sodium intake can worsen blood pressure and kidney stress, indirectly impairing uric acid excretion, while preservatives and ultra-processing are strongly linked to metabolic syndrome, insulin resistance, and obesity, all major risk factors for gout. In this context, processed turkey is often no safer and sometimes worse than traditional processed red meats for urate control. Portion size is another critical issue. Because turkey is marketed as lean, people may eat it in larger quantities without concern, especially during holidays or in high-protein diets. Large servings create a concentrated purine load that the body must clear all at once, placing extra demand on the kidneys. In someone with even mildly reduced renal urate clearance, which is common in gout patients, this can result in prolonged uric acid elevation lasting well beyond the meal itself. Repeated exposure in this way may not only trigger acute flares, but also contribute to chronic joint damage and urate crystal deposition over time. Cooking and preparation methods do little to eliminate this risk. While boiling may reduce purine content slightly by leaching compounds into the cooking liquid, most common preparations such as roasting, grilling, or frying leave purine levels largely intact. Skin-on turkey and darker meat cuts further increase fat intake, which may worsen post-meal inflammation and impair insulin sensitivity, again indirectly raising gout risk. Combining turkey meals with alcohol, sugary sauces, refined carbohydrates, or salty sides, a common dietary pattern, further compounds the problem by promoting dehydration and increasing uric acid production. Although turkey does provide high-quality protein and B vitamins, these nutrients can be obtained from safer alternatives for gout-prone individuals. Eggs, low-fat dairy, tofu, legumes, and modest portions of chicken breast generally offer comparable protein with a lower impact on uric acid levels. When animal protein is consumed, rotating sources and keeping portions small is far safer than relying on turkey as a staple. During active gout flares or periods of unstable uric acid, turkey is best avoided altogether, as even moderate amounts may prolong symptoms or trigger recurrence. In summary, turkey should not be assumed to be a safe meat for people with gout simply because it is lean or commonly recommended for heart health. Its relatively high purine content, tendency to be overconsumed, and frequent appearance in processed forms make it a meaningful risk factor for uric acid elevation. Treating turkey as an occasional food, choosing small portions of unprocessed cuts, and prioritizing lower purine protein sources is a more protective strategy for long-term gout control and joint health.